And this person they were on an Aetna plan with their previous job. They switched to real estate and they saw an Aetna on their state's exchange program. They clicked it. They thought, hey, deductible looks the same. Out of pocket is very similar. Copays, everything looks the same. But they didn't realize that the network was completely different. And that's where we come in, because it's no one's fault. If anything, it's the carrier's fault, because they kind of hide that a little bit, because they know that you're just going to bank on that name and, oh, it'll work because it's an Aetna plan, but it wasn't this specific Aetna plan. And so that leads to a lot of people being on the plan that's not right for them. So that's where our team of benefit consultants come in. So they are there to help walk you through the process and make sure that, hey, we're recommending these plans. This is why. And that you have an understanding of how do I verify doctors and providers and hospitals. They walk you through all of that. And we have 3 goals that we want to accomplish. Hopefully all 3, or one of the 3, or 2 out of the 3. We want to help lower those monthly costs. So those are going to be your premiums. Those are going to be your day-to-day visits. So annual checkups, maybe you have to go to a specialist for a minor injury, refilling your prescriptions. So all that, we want to help drive that cost down. We want to upgrade your network. So all of our plans are PPO. What does PPO mean? It stands for Preferred Provider Organization. Basically, it's what most people want. I personally think that they're the best network out of all of them. Why? 3 reasons. 1, it's going to give you more of a list of providers to choose from, so you have more choices. 2, you don't have to go see your primary care doctor before you see a specialist. So like with my ankle injury, if I was on what's an HMO plan, which is fairly commonly used in this country, if you're on an HMO plan and you need to see an orthopedic, you first have to go to your primary care doctor, who then recommends your orthopedic doctor. So I essentially had to pay my primary care copay for a visit that was basically meaningless. I just went there to get a mandatory recommendation, basically. And we want to help lower, and also with PPO networks, there is out-of-network coverage. And we want to lower those out-of-pocket costs. So out-of-pocket costs are, I think, the big ticket items. Hopefully you never have to think of them, but that's, oncology visits, that's staying in the hospital, that's going to the ER. And these are just some of the perks that come with any plan that you get. Free telemedicine, super, super convenient. Maybe you have a lot of open houses but feeling a little bit under the weather. Maybe you were walking around, resetting some pieces in the house, stubbed your toe. You can go on, speak to a qualified MD professional within minutes, and they can either prescribe something on their phone, say, hey, you just need to do this, and then I would go to an urgent care center. So that's also incredibly convenient and helpful, and that is a $0 copay. Free preventative care as outlined by the Affordable Care Act. So all of these plans are ACA compliant. Mental health, because we believe that it's just as important as physical. We've partnered with Talkspace. Talkspace is one of the premier mental health online centers. We've actually had people join these plans because they're actually saving money versus just going on to Talkspace.com and signing up for it as a standalone product. And like I said, we've been lowering the cost of prescriptions, and we have multiple programs to help people with those very specialty drugs that cost upwards of thousands of dollars. So I kind of did mention a little bit about why having a stronger network is better, because it does allow you to have access to more providers without having to pay huge sums of money. Particularly when it comes to you don't always have control over what's going to happen. So it is nice with that PPO plan that you can go if needed to an ER or a hospital that's out of network, and you're not going to be completely left out in the cold. Care coordination. This is something that's new, and it's absolutely incredible. Care coordination is a dedicated team to help members schedule and research doctors, hospitals, providers. So I would, if I needed an orthopedic surgery done, I'd call my name. Here's my member number. I need X surgery. I live in Austin, Texas. Care coordination would provide me with the list of highly qualified surgeons. And if I go with any of those providers that care coordination lists, I pay $0, not one penny. That's thousands of dollars in savings right there. Oh, okay. And what I also love about our consultation process, if you currently have a plan, you want to do a comparison side by side, go ahead and just schedule that. You have nothing to lose. You'll learn more about your current plan. You may get an upgrade, but if you're on the right plan, given all the variables, we'll say, you know what? Congratulations, you're on the right plan. So our team is here to help you out. Think of us as like EXP's benefits department. Okay, so we've got a couple of options that are available. We have like our very innovative health share. Health share is a type of benefit that's within the industry. This is going to be your most cost-effective plan. This is really going to be for people that rarely see the doctor and just need something in case of emergencies. But we do have different levels that your consultant will go through. I'm on the advanced myself. Like I said, I've had ankle surgery with this plan. I've been to the ER twice with this plan. It's worked every time. I've had a couple of sprains and stuff. It's worked out just the way that it was supposed to. And we can also, with all of our plans, supplement that with dental, vision, accident, and critical illness. So I do recommend at least asking your benefit consultant what the prices are, particularly with the accident. I know it's a little dark, could end up being a good investment. I've already used it once, and it paid for the premium for the next 2 years. We do have major medical plans. These are all insurance plans. So pretty much like everything is going to be covered. And we have copay plans, HSA plans, minimum value plans. So those are going to be like your lowest price plans. So again, ask your benefit consultant, have that conversation to see which one is right for you. All right, I don't know why this is. Okay, so when to enroll. One of the other, on top of all the amazing things, another amazing thing is you don't need a qualifying event for these plans. So on every state's marketplace, their healthcare.gov site, if you don't have a qualifying event, even if you wanted to enroll and you have the money to enroll, you can't get on a plan. So our plans have no qualifying event. You can enroll all year round, which is absolutely amazing. It just depends on when you need coverage to start. And again, a benefit consultant will help guide you through that. And you can visit expagenthealthcare.com to get a quote, book a call, enroll. I think what I'll do is I'll stop this presentation, open the floor to some questions, and then I will go on to expagenthealthcare.com and sort of show y'all around that so you can see that, the site.
I was about to ask. So I want, first of all, I have to tell y'all the story how I even met Spencer Block. We wanted to do a healthcare training. And I'll be honest, I wanted to do it for myself to see if I could save some more money by converting what we have to what EXP offers. And I didn't know how to maneuver through the system. And so I was so excited when I got to the event. I'm going to repeat that again. When I got to the event, y'all need to go to event. Guess who was set up in the what do you call it? The
So
sponsors
Expo Hall.
right? And Spencer with help. I was like, oh my God, y'all, we gotta go over there. I've been trying to figure out this health insurance thing. And Spencer was gracious enough to put me in his calendar on that very same day in that time slot that I was sitting there at the booth. And so thank you for being here with us, Spencer, because I know a lot of people are afraid to even leave their 9 to 5 and do real estate full time because of insurance coverage. You know, they feel safe and secure where they are in terms of their health insurance. So I want to just say thank you for being here and thank you for educating us. I do have a question. I think you're
Yes, go
about to
ahead.
answer it though. It's where do we start? I'm new to EXP. Let's just say I heard about the health insurance. How do we start? Like, where do I go?
That's a great question. And we're working with the tech team at EXP to make all that information much more available.
Okay.
And y'all will have that communication. Like once it goes, it'll be on like Workplace and it'll be in the world, very easy to access. And thank you so much for having me. I love talking to the agents at EXP. I love y'all's business model. You know, I've been to enough events where they tell me how, you know, Glenn came up with this idea to really flip the real estate industry on its head with this new, you know, the becoming the largest independently owned broker. Do I have that right? Yeah. So and we're kind of like that with, you know, health insurance and benefits. We want to kind of emulate what Glenn has done in the real estate world, and we want to do that in the benefits world and offer this up to y'all. So and you know, also when it comes to, you know, people scared to leave those 9 to 5 jobs, like again, like all of our consultants are licensed. I've I have actually helped agents negotiate their Cobra plans. So they got like a 4 month, like one person for her family got like a 4 month Cobra plan for super affordable. And that gave her some time to like shop around for plans and not feel that deadline coming up. So again, like EXP Agent Healthcare, we are y'all's like benefits department that you'd find at any like big, you know, major company.
All right, thank you for that. And then Sandra, unmute yourself. You have a question?
Okay, so what do I
Hold
do?
on,
I need
Spencer. We've got another
yeah.
question.
Oh, sorry. Okay. Is it
Can you guys hear
Sandra.
me?
Yes.
Can you hear me? Okay, good, good, good. So first and foremost, again, Spencer, thank you so much. I'll piggyback on everything Claudienne said. This is absolutely phenomenal. And speaking to the 9 to 5, this was one of the major hesitations for myself as well when I got into real estate full time, was letting go of the security of benefits, especially when you have dependents. And so my question, which you answered right before you unmuted me, if you will, was can we also have family members on our plans or create a plan for our families or anyone that we might be responsible for or a caregiver to?
Yes. Yes, these plans are available for EXP agents and their families.
Good
Love it.
question. Good
Thank
question.
you so much. Thank you.
Thank you, Sandra. You know, sometimes I forget that I got 2 little ones that I'm still responsible for. All right, take it away, Spencer.
All right. So, share my screen. Okay. I want to check out what does this agent healthcare have to offer? Go online. Can everyone see my screen? Let me try again. I don't think it got it. Okay, there we go. Okay, so we go to expagenthealthcare.com. Go ahead and click that. it'll take you to this home page. You can watch a quick video by Jason Guessing. It's got some of our highlights, the care coordination service, the expanded PPO network, the telemedicine. So you can scroll down and basically, but if you don't want to scroll down to go through everything, right here, the top down menu will also have this drop down menu right here. So you've got your plans. So you can learn a little bit more about HealthShare, the advanced plan, the basic plan. So it sort of shows everything about the advanced plan. If you go to the major medical, it's going to talk about those. And supplemental, I'm not sure what that, I think someone's drawing on the.
Hold on. Release sharing your page and come back.
Yeah.
Okay, now come back.
Let me try. Okay, there we go. That should do it. Okay. So then you go resources. That's going to have more about our care coordination and an FAQ glossary page. So, are plans available in all 50 states? Yes. Can I enroll if I do not have a SSN? All this stuff. And then you can go to our support line. And then right here, these are probably the two most important, is you go to book a call. So you can put your name in. I do. You don't have to use your EXP Realty address. I'm just putting that in there. And then you just pick the time and date. And what's cool about the calendar is it will adjust to whatever time zone you're in. So right now this is all in Central Time, but when you log on, it'll adjust to your time zone. And then you could also do a quick quote. And it's pretty simple, takes no more than a minute. So you do let's get started. Who will be on the plan? So again, I'll just do it as myself. So it's just me. Do you currently have an HSA plan? So if you do have one and you want to see about our HSA plan, real quick, if you don't know, HSA stands for Health Savings Account. You essentially open up your own bank account. Yeah, you basically open up another bank account that you contribute money towards, and that money compounds over time, and you use that money to pay for out-of-pocket expenses, which then you can deduct from your taxes. You can also use HSA money, and it's really cool, is you can use it to invest. So, for example, let's say I have $6,000 in my HSA account. I put $3,000 into XYZ stock. And when I sell that stock, I get $6,000 in return. As long as I put that $3,000 back into my HSA when I file my taxes, the profit that I make isn't taxed. So again, so HSAs, like a lot of the really crazy financial people love using HSAs. Also, HSAs are very popular with people that either themselves or their family has a serious medical condition, and they know for a fact that they'll be hitting their out of pocket every year. So it's sort of like, well, if I'm going to be paying that much anyway, I might as well get the tax deductions on it. I'll just go with the advanced. So Jason asked, like, how often will you need insurance for day-to-day medical needs? So it's like, do I need it more often than not, or am I barely going to go? So I'm like, well, I don't really go that much. Okay, how much do I feel comfortable spending out of pocket for a surgery or something major? So basically, this is asking is, if I need to have surgery, if I go to the ER, what amount am I most comfortable paying pretty much in like one go? And you know what? I'll do the 2,500, even though the monthly cost will be a little bit higher. To me, like 2,500 is a lot easier than 5,000. I'll go 29. Do I want the extra critical illness or accidental? Again, this is just a quote page, doesn't lock you into anything. So I'll say, well, I'll just see what it looks like. I'll say, let's see, the last plan I had, I think I was paying around like 500. That's just for us to make sure that we're always keeping our prices as competitive as possible. Okay, so health share is not the best for people with pre-existing conditions, and the consultant will go over that with you if you do have one. But we also have plans that have no like pre-existing condition guidelines. So I'm like, well, I haven't had any of these. So I'll hit submit. Okay, read everything. I'll hit submit. And then this page will pop up. So it's recommended me a plan. It's given me like my most affordable option, and it's given me like the premier option. And then you just click on plan details, and it will show you the plan outline. And I'm like, well, you know what? I still have a couple of questions. So I'm going to go ahead and just click register now. And I can go ahead and book a call. And that's pretty much it.
All right, all right, all right. Does anybody have any questions? All right, we got a couple questions. Let me unmute. Let me unmute the participants. Hold on. All right, you guys can unmute yourselves.
Okay, is it okay if I go, Claudine, up first?
Yeah.
Oh, okay, thank you. I just wanted to ask, if, for example, on the supplemental dental, can you just go ahead and do like an a la carte and just get a quote for like, major dental, supplement, with this program, or no? Oh, he's unmuted.
That's a great question. So right now our quote tool doesn't include adding dental and vision. A consultant can help you do the price adjustments with the dental and vision. But if you do just want dental and vision as a standalone, we can also do that as well. And if you do enroll in the medical and then sometime later down the road you decide I want to add dental or vision or both, we can do that for you as well.
Thank you.
Any other questions?
Yes, please. Is there any limit, for example, if you did get cancer or something catastrophic like that, and as you said, it can easily cost $440,000. What happens if you have a premium like that? Does it cover it all, or is there a limit? Can you get the treatment you want or think is good? Or
That's excellent question. Hopefully no one here on this call or at EXP or in the world doesn't happen to, but it does, unfortunately. So that's a great question. So For the major medical plan, the all insurance plan, there's no limitations. And if you're on the health share plan, there will be a cap on for certain types of cancer. So the one is, if I was a heavy smoker, I get lung cancer, there's a very clear correlation between my smoking and my lung cancer. The health share plan will only pay up to $50,000 a year for that cancer treatment.
Okay.
If it's not caused by that, that's just unlucky, then there is no cap on the health share either.
Okay. So basically, if you haven't done anything stupid in your life, everything is covered.
Pretty much, yeah, pretty much. And remember, with care coordination, if you go to an oncology center that was recommended by care coordination, you're paying $0 for that cancer treatment.
Okay. Yeah. But in a serious situation like that, you might want to do your own research and might want to choose.
Yeah, and all of our plans offer the choice. If you don't want to go with the one that care coordination recommends, you still have the option to go through your own research, and you'll still be paying less than what most people would be paying on the marketplace out of pocket.
Yeah.
I don't know if y'all have met Margot Wickersham. She also works at EXP Agent Healthcare. She was on one of our plans. She's like pretty much now in full remission, but had a very serious case of cancer and went to MD Anderson in Houston. What would normally be, 80 to 100,000 per visit, because you're there for a few days. It only came out to 2,500 per year.
Yeah. Yeah,
Yes.
because premiums are good.
MD Anderson's very good for oncology.
I think Stan Juanita wants to ask another question.
I did, thank you.
Okay.
And it brought up what Annette was asking or saying, but I was just so I'm clear. Generally, if you're a very healthy person and you do get involved with whichever of the products, and then 2 or 3 years down the road, not counting you're a smoker, but then you do come down with some issues, whether it's liver cancer or whatever it might be, and you do cover that. But then, do your rates then actually adjust to doing that? In other words, just like if you get into a car wreck, they automatically will nail you, and you'll have to pay a higher premium.
That is a good question. So your rate will go up a little bit, but the way that we've structured the plans on the back end, we've never had, and we've had some people go through some serious procedures. We've never had the plan go up more than 3%.
Oh, perfect. Thank you.
You're welcome.
Do we have any more questions for Spencer? This is the time to ask. I love PPOs because I could literally go to any doctor that I please. It has always worked for me in the past, so I'm a PPO girl. So I am glad to know that the plans are PPO plans. And thank you everybody for joining us today. I see Icon Agent Sonia is here, Lavinia is here working out. Just everybody, just thank you for being here. Every Wednesday at 7 p.m. we train on something. We're gonna be having Pace Morby, the king of real estate investing, on here on the 28th, and we're gonna have some more trainings for I think the 14th and the 21st. So guys, make sure you get your teams on here. If you have no more questions, I'm gonna go ahead and just release Spencer. Spencer, thank you. He has left his email in the chat box. So if you have a very specific question, and he is very good at responding. There has not been a time where I emailed him and he did not respond. And so you have his email. I don't know Okay, you can also find him on Workplace. I'm training.
And thank y'all so much for letting me speak. It was truly a pleasure getting to talk about this and answer any of y'all's questions. Real quick, some events that we'll be at. We will be at Build on July 10th, and we will be at EXP Con, which I think is October 10th. It's early October. So we'll be there. I know EXP Con, we're going to be having some exciting announcements, so definitely go there, say hi to the team. Our team of benefit consultants love to meet the people that they speak on Zoom. It's really a heartwarming moment when we get to make that personal connection.
All right, guys, training is over at 7:36. Thank you for joining me. Thank you for the support. Guys, I do this for us, not just you, but for me too, for us. So listen, that's our time. Meet us here next Wednesday, same time, same link, same place. Bye, everyone.